Thank you very much. Yes, I am a genetic counselor, but I also, actually what I do now is manage, I co-founded this organization in Quebec, the Quebec Coalition of Orphan Diseases, and a Rare Disease Information and Resource Center. It's a service that's free, bilingual, confidential, and the service is given by a professional. Anybody can call us, write us up for information on any of the 7,000 rare diseases. This is an old picture. We have an information agent who's knowledgeable in medical genetics, Mihai Pescariu, who answers. Now, through this center, and since we've been keeping good statistics since 2014, we had over 225 inquiries for Ehlers-Danlos syndrome. Now, maybe some of you wouldn't be surprised, but it was surprising to us because it's the disease for which we have the most inquiries. We barely have more than 10 sometimes that call or write us for another rare disease. There's so many rare diseases that it's either a one-time thing or sometimes twice, two inquiries. Anyways, the maximum is probably 10. So getting these hundreds of inquiries for Ehlers-Danlos syndrome really sounded an alert since our founding actually in 2010. The main requests are how and where to get a diagnosis, finding specialists who know EDS, and information on the syndrome, and information on management and treatments. So actually we decided to kind of to create another sub-center of support and research on EDSs and hypermobility spectrum disorders. Now, when I'm talking about research, what I mean is research into collecting data, actually, on this subpopulation of patients who contact us, because for years we've been advocating to our government to also have an EDS clinic, to organize management and care, better diagnosis, and we hadn't been getting anywhere. So what we decided to do is collect data. And the first thing that we decided to do is determine the needs and priorities of the Ehlers-Danlos patients. So this is not an academic research. I want to tell that from the get-go. So it was a survey monkey. It was a survey monkey. I want to thank the LAM Foundation. I'm going to try to say this word, which Lymphangiomyomatosis Foundation. I don't know if I'm saying it right. I always have trouble with that, especially in English. So I met them in a meeting in the US, and they had created this questionnaire, but it's not a scientific academic questionnaire. That's their board of directors that decided they needed to determine also the needs and priorities of their members. And this was a collaboration between our organization and the ILC Foundation, because we were thinking, if we do this in Quebec in French, it would be easy to translate and do it across Canada. So that's, with Sandy, was a nice collaboration. So it was in French and English. And I want to thank Ms. Alicia Pocia, which is a volunteer student who helped us out with this survey. So it was a two-part survey. Part A was for a person affected by EDS, 14 years and older. And the second part was for a parent of one or more affected children. So we analyzed this. We stopped collecting the data. Actually, it's still ongoing. We're still getting some responses to the survey because we have it online. But we stopped at one point. We had 153 respondents. You won't be surprised to see that 94% of the respondents were female. And the age group, the most prevalent age group was from 30 years to 60 years, which is actually the age group that calls us up and contacts us the most. So, as you know, mostly women in this age group who had health issues since their childhood or teenage, but finally find us somehow and try to get a diagnosis or better care. The geographic distribution, well, there are much more respondents from Quebec and Ontario. The second group was from New Brunswick, Nova Scotia, but I think because there's an active support group there. I was kind of disappointed. Saskatchewan, British Columbia, Alberta, so I think that, well, for us, because we're mainly a French group in Quebec, and we thought we'd get more French Canadians from other provinces, but I think there's some work there to do. I'm pretty sure there are also EDS patients who need help in those provinces, or who are there. So, survey part A. It was a long survey, maybe too long, but people were generous in their answers, and I'm giving some responses here. So the question was, what are the 5 most challenging aspects of living with EDS? And so I'm giving you the 5 first here: pain, lack of awareness from the medical community, fatigue, exhaustion, lack of medical resource and proper care from physicians, and the dislocations. So some of the others that are relatively frequent: lack of understanding from the social community too, not being able to work, financial uncertainty, GI problems, medical expenses, the comorbidity, many symptoms to cope with, and sleep disturbances. So those are the 5 ones. I'm not going to comment, and you'll see the trend, the other questions. There were 74 other items mentioned. And I can't go through all this, but it just shows and remember, the question was the 5 most challenging things. So even if one of these was just mentioned one time, it still was one of the challenging things for that person. And so it goes from the symptoms to challenges with everything. In these surveys, we saw things about even assisted suicide, about all kinds of issues. So it just shows I think the challenges with this disorder. Question 7 was, name the top 5 symptoms, EDS symptoms you experience that limit you. You won't be surprised again. Pain, fatigue are the 2 that are up there. Dislocations, GI issues, and also we put together headaches, blurred vision, migraines, dizziness, and again there were 70 other symptoms. And that shows, I'm not going to show those in the slides, but that shows also the multisystemic nature of this disorder, where all kinds of symptoms can show up and be important or serious for one person. So, but up there is still pain and fatigue. What is the most frustrating thing you have to deal with each day or routinely? Again, pain, fatigue, lack of understanding from everyone, including doctors, limited physical ability, unpredictability for injury. We have less respondents there because if I had to do this, I'll be changing the survey a bit, because I think it was time-consuming and a bit repetitive. And then question 10, the symptom or aspects of life with EDS that is the most underappreciated by my doctor is extreme pain despite looking fine, fatigue, lack of medical knowledge, GI issues, and not being taken seriously. So, in conclusion, and the survey said, I think it's obvious the 5 main issues are pain, fatigue, together lack of awareness, understanding, knowledge, proper care, the joint problems, and the GI issues and the POTS-like symptoms. So for pain, I just want to make some remarks in the context of the Quebec situation. Anyways, in our experience with our center and all those calls, is that it's nice to see that the ILC Foundation actually started with the pain issues. It started out like that. You were connected fast and rapidly with a pain clinic and physicians who were interested in helping these patients. And now you even have a very big research network going on with the SPOR, the CHIR, if I say that right in English. However, in Quebec, pain is not recognized as part of EDS. Patients can't get into pain clinics. If they get in, they're often, either the diagnosis is reversed, they don't believe it's the EDS, the physicians, or they're sent off. They're sent off, they say, we can't do anything for you, and the worst of all is being sent to the psychiatric department. So that's still a reality in Quebec. And I met with rheumatologists at one point because I was working with the Arthritis Society because they have EDS in their related disorders, but actually they're not doing that much. But it was great in Quebec. We have a collaboration to try to do something together. So at one point I went to see some rheumatologists and told them that we're having this collaboration with the Arthritis Society. And the rheumatologist answered me, oh yeah, the Arthritis Society, they're only interested in pain and fatigue. And I was just, actually, I didn't know what to say to that, but it just told us, this is why this is important, this survey. You see that pain and fatigue is number one and number two concerns of these patients. If they did this survey with their arthritis patients, I'm sure that would be the same thing. And that's why the Arthritis Society, that's what they're giving support for. And so the important thing is listening to your patients. So I think these rheumatologists, that for them, pain and fatigue is they have to deal with it, they have to treat it, but that's not really what they're interested in. They're probably interested in all kinds of other more sexy subjects or research. So, and fatigue, there are a lot of questions in the survey about where does the fatigue come from, what causes it, what can we do about it, it's really a big issue. Now, you won't be surprised by the third one, lack of awareness, understanding. I think in Quebec and in other provinces in Canada, it's the same situation as around the world. Physicians who don't know about the disorder or learned it when they were in medical school, and it was very simply 3 signs and symptoms and not the disorder as we know it today. In Quebec, we've had patients told that, or even physicians told, or myself, that they don't believe in this, that EDS is what we call in French a diagnostic poubelle, which means that now people are thinking that EDS, everybody is put into EDS and seeing EDS everywhere, like fibromyalgia some years ago. And in Quebec, there are some physicians that try to care for their patients properly, but there's many who don't know, who don't look up for any articles or management guides. We know there's not many management guidelines, but still you can get some information, and they don't do it, and they don't know how to deal with it. So, joint problems, it's all, the question of orthesis and prosthesis was brought up a lot, and we'll get into the solutions. And so GI issues, POTS-like symptoms. GI issues, we have found some gastroenterologists in Quebec who want to try to care for the patients. So questions 9 and 11 were trying to find what solutions you can think of, what products, services, innovations could be developed to improve your life, What would help your EDS physicians and healthcare providers to do a better job of taking care of you? So the first item was knowledge and the ongoing medical training in EDS, that the doctors educate themselves about EDS, its complexities and the comorbidities or the multisystemic aspect of it. So, so kudos to you, because for 5 years, the ILC Foundation has been organizing this meeting in Canada, the only meetings for medical training in EDS. And but I think we're trying to also to get something up in Quebec, but it's very difficult. It's just one other disorder for most of those physicians. And second point is communication and collaboration between physicians. Seeing so many specialists, obviously, that they talk, every person says, why don't they talk to each other? So that's very important for them. So having a multidisciplinary clinic like you're having here is a solution. Sharing the medical records. In Quebec, we still don't have electronic medical records yet, province-wide. A network of specialists and practice guidelines. So obviously some demand EDS clinics, like for us in Quebec, a one-stop place for health services, comprehensive multidisciplinary treatment program, and obviously listening, understanding, and empathy, they would like to see as a solution to and for support, well, they talked about home support, psychological support, a patient portal, support groups, and financial support. I just took one here quote. What would help your EDS physicians and healthcare providers? To understand that we know that we are complex patients and that it is by no fault of our own. That if they would just sit down and talk with us as normal humans instead of a burden, that we could get everything done and get it done faster. Just work with us instead of being intimidated by us because we know more about our illness, which is often the case, than they do, to take time to learn from us and be challenged to learn more so that they are in the positions to provide better treatment for the next EDS patient that they see. Other solutions, obviously better adapted orthosis, prosthesis, better adapted walking aids, access to compression garments. I don't know if you have discussions about this in Ontario, but in Quebec, it's a big discussion because we're connected a lot with Dr. Ramonet's clinic in Paris, and he's a physiatrist he's in physical medicine. And for 20 years, he's developed a lot of solutions for treating the pain and the joint problems. And one of them is the compression garments. We even have some Quebec patients who went there to get some compression garments, cost them a lot. And so we're trying to do something about that. It not only resolves the joint problems, dislocations, but I've talked to patients in Paris and in Belgium in education days, and it reduces pain also. Then they would like access to pain control therapies. Research, they talked about stem cells, gene therapy, a cure. Research on pain treatments, a lot, okay, to relieve joint problems. So one had a very original solution here, a compression suit with a TENS machine included in it, 3D printed bracing. The person said, it's my intellectual property, but you can take it if you want. And it would be good if it could go into an Epsom salt tank. So, now, I won't go more the detail, but survey part B for children, these are again the 5 big issues. Lack of help, knowledge from doctors, pain control, being different, GI issues in school, and for the other questions, it resembles very much what the adults have. I just want to say, I'm going to finish there. I'm told that I don't have any more time. But we find it so difficult in Quebec to get collaboration from the medical community. I've left messages to physicians, to other healthcare providers and rehabilitation centers and pain clinics, and they don't even call back. They don't even, for them, it's really not an issue. And it's also, Very difficult, the collaboration with patient organizations. And so I talk a lot about patient engagement, and patient engagement is not only your engagement in your care and your health, but it's also that the medical community allow you to engage in everything they do. So, that quote I gave also from the patient is really what the patient wants is being a partner, that they're a partner with their physician in their care, that they share decision-making. That's what patients want. And I think it's a buzzword now around the world. There are a lot of programs, so I think we have to do that. So thank you very much. Actually, I want to thank all the respondents. Thanks for your voice, and that's the kind of research we're going to continue doing, is to have your comments on different aspects, and for the health authorities and for the physicians. Thank you.